Hi guys. So my venture idea kind of comes from 450 last semester, and it's called Pillbox. Pillbox's purpose is kind of to mitigate the effects of the ongoing opioid crisis through using regulated smart pill dispensers that would then directly be filled by pharmacies instead of the consumer to prevent misuse. And Pillbox is designed specifically for short-term use and for first-time opioid users. So this could be someone like who just experienced a major surgery, who was in a car crash. Also tends to be younger demographics, usually like around in their 20s, early 30s. And this is a really step in the right direction because from 1999 to 2019, there were nearly 500,000 overdoses in the United States, and the largest largest portion of those overdoses came from opioid misuse. So that shows that there's a clear problem that we do need to start working to prevent the opioid crisis. And Pillbox directly would be sold to pharmacies instead of the consumer, so that this prevents misuse from the patient side and also creates ease, as the pharmacies would fill the smart pill dispenser, which then has a system and a reminder countdown that pharmacists could program based on how often patients are supposed to take the specific opioid medication. And it would also have an anti-fail system just in case something was to happen in the device. We also last year worked on creating different features as a subset. So the business model would be one-time fee plus maintenance for the device. And then we also talked about adding a supplemental additional app to create revenue over longer periods of time, because we predicted about 6 months revenue max would come from just the portable devices that pharmacies would order in bulk at a 50% markup for about $45. And these features would include, for free, you would have reminders and a pain scale that you could send to your doctors and physicians, as well as communications with these doctors and physicians with any questions you may have about opioids or any of that, or if you're not feeling well or you need to adjust the dosage. And then the additional paid features, which I know we kind of said apps aren't the best way to go, so we're kind of looking at that, but we were looking at kind of using a geotagging system, kind of like the Apple Air chips that would connect to Find My devices, and then possible educational seminars. And we're looking at a partnership maybe with Calm Meditation app, because there are studies showing that due to the ongoing regulation or the strict regulations on opioid medications, that opioid users sometimes do experience higher levels of stress. So we probably would be looking at that a little bit more in depth as well.